How to know if you have herpes. The herpes simplex viruses HSV1 and HSV2 are the viruses responsible for herpes infections. While they cause only minor skin rashes, and are extremely common, it is estimated that 56% of adults have HSV1, and 16% have HSV2. These viruses can cause a lot of distress because of ignorance, stigma, and outdated ideas about sexual health. Although doctors can treat symptoms, ease pain and reduce the possibility of spreading the virus, it cannot be cured. Instead, it goes through cycles of dormancy and can reoccur at any time, with or without symptoms. 2. Find out if you have herpes by examining high-risk behaviors, recognizing symptoms and getting tested. Recognizing herpes symptoms. Learn about the herpes viruses. There are two types of herpes simplex virus HSV, HSV1 and HSV2. Both can be considered genital herpes, since both types can be spread to the genitals. However, HSV2 is far more common on the genitals. HSV1 is the strain most common on the lips and mouth, but it can be spread through oral sex. Just like HSV2, treatment is an important part of managing the disease. If you don't treat genital herpes, you may spread the disease to others, including your baby. If you're pregnant, experience bladder inflammation, notice rectal inflammation, and in severe cases, get meningitis. Watch for symptoms approximately 2 weeks after contracting herpes. While it may take a while for the first outbreak to appear, it's usually worse than outbreaks that come later. You may not know that you've been exposed to the disease, so pay particular attention to any symptoms you start to develop. General flu symptoms are signs of the infection. These might include fever, muscle aches, decreased appetite and fatigue. See a doctor if you think you're experiencing your first herpes outbreak. It may be difficult for some people to realize they've been exposed since it can take so long for symptoms to show up. Or, because the disease can be spread through people that don't show obvious symptoms of herpes. Watch for redness and itching. After you've had sexual contact, pay attention to any redness or itching on your genitals or around your mouth. You may also notice tingling and hot skin at the affected area. A few days later, you may also see a rash or outbreak of herpes on your skin. Trauma, stress, or menses. These can release cortisol, adrenaline, and other stress hormones or dramatically change the levels of hormones in your body. Any of these may lower your body's ability to fight infection. This gives the herpes virus an opportunity to become an outbreak. Burning and itching before an outbreak, known as a prodrome. Reducing the itching and burning as herpes is on the verge of breaking out can speed up the outbreak. Scratching once the outbreak has happened can lead to more outbreaks and spread the virus. Sunlight and fever. Sunlight exposes your body to ultraviolet radiation, which can irritate the skin and compromise the underlying cells, giving an opportunity for a herpes outbreak. A fever or cold compromises your immune system so your body can't suppress the infection, which leads to an outbreak. Look for blisters or on and around the genitals. You may notice small blisters bulla or vesicles appear approximately 6 to 48 hours after other symptoms emerge. On women, blisters can appear on the labia, vagina, anus, cervix, buttocks and thighs. Ulcers usually heal within 7 to 14 days. On men, blisters generally appear on the scrotum, penis, buttocks and thighs. Notice any painful urination. During an outbreak, urinating can be very painful. If you're having trouble emptying your bladder during an outbreak, as some women report, get medical attention. Keep in mind that vaginal discharge is not a diagnosing symptom for herpes, but it is a possible symptom that, along with other symptoms, may help diagnose herpes. 10-11.